Hello and welcome to my YouTube channel. My name is Amanda and I am a psychotherapist working at my private practice called Ndidi here in Lagos, Nigeria. And I have this YouTube channel to be able to educate you and entertain you with information about mental and emotional health so that you can be better able to take care of yourself, be more aware, and take care of the people around you. On today's show, we're going to be talking about depression, and the goal is that at the end of watching this video, you'll be able to define what depression is, to know the difference between being clinically depressed and feeling sad or experiencing melancholy, to know what the causes of depression are, what the symptoms are, and what treatment options are available if you are depressed or someone you know or love is depressed. Depression is a common mental health disorder that is characterized by intense and persistent feelings of sadness or low mood and a lack of interest in things that you normally be interested in, like going out to the movies, hanging out with your friends. Now, people who are depressed find that, and people who suffer from depression find that it affects their thoughts, their feelings, and their behaviors, which means that it impairs their ability to function normally. It affects your work and your productivity, your ability to connect with your friends and your loved ones, and for you to even just enjoy life. Now, there is a difference between being depressed clinically and feeling depressed or just experiencing melancholia. Sadness is a very normal human emotion. But when you're just feeling sad, it could be as a result of a missed appointment, you've misplaced something that you really care about, you ended up getting rejected at a job that you interviewed for, or someone told you no. And this feeling of sadness can last for 2 to 3 days or even a week. And then your friends come over and try to talk you out of it and you get cheered up. Or you can even talk yourself out of it. But when the person is clinically depressed, it is a medical disorder, which means that they can't just wake up and be okay. And they can't just get over it just because you say that they should. It is a medical disorder that requires attention to treatment. There is no single cause for depression. Till today, scientists have not come up and say that this is the one particular thing that causes a person to be depressed. Depression, clinical depression, is as a result of a mixture of many different factors. They could be genetic, they could be environmental, and it could also be hormones and your life experiences. So I'm going to run through a list of different things that could actually cause a person to be depressed. The first one is significant life changes. Getting married, having a baby, you've heard of postpartum depression, moving jobs, moving locations can trigger depression in you. Abuse, experiencing abuse in the past or even in your present day reality can all cause a person to experience depression, either during the time when it's happening or later on as they get older. They find that they have deep feelings of sadness without knowing exactly what the triggers are. Another factor that can cause depression is the side effects of medications that you take, which is why it is important for you to always discuss the side effects of the drugs that are being administered to you at the hospital with your doctor before you start to take them. Drug abuse as well can be a trigger for depression. More often than not, you find that people who use drugs to escape their reality are actually suffering from depression. Another cause of depression, sorry, that's my laptop, so I'm looking at it. Okay. Another cause of depression is genetics. Usually when a person has a family history of depression, where their grandparent was depressed, their father was depressed, their father's brother was depressed, there is an increased likelihood that they as well are going to experience depression at some point in their life. Some people end up not even experiencing depression at all, even though they have it in their family life, because it takes a significant issue that is overwhelming for you to experience and you can handle it, for you to trigger depression inside of you. So something has to have happened for you to feel depressed. Another thing that could cause depression is physical health problem. If you have a terminal illness like cancer or HIV or diabetes, it can cause you to experience depression because you feel sad about what your body's going through and it makes your future look bleak. So now we're going to discuss what are some of the symptoms of depression. Now's a good time for you to pay attention to this because you can use this information to figure out if you need further help. That's to speak to a professional to know if you are clinically depressed. So, how do I know if I'm depressed? For a diagnosis of depression, you must have experienced at least 5 of the following symptoms for more than 2 weeks. The timeline of more than 2 weeks is very important, and it's pretty much what separates feelings of sadness and melancholia from clinical depression. The first one is a depressed mood for most of the day or nearly every day. So for the past 2 weeks, you have been feeling sad and your mood has been low back to back or most part of the day. So you'd say like 2 weeks consecutively for most part of every single day, you've been feeling sad or you've been experiencing a low mood. The second symptom of depression is a diminished interest in activities that you would normally be interested in. So you just want to stay at home. You don't feel like doing anything. You just want to stay at home by yourself, or you just want to go somewhere else where you are isolated or on your own without anybody interrupting you. The third symptom of depression is a significant weight loss or weight gain without even trying. So you're not trying to lose weight and you're not trying to gain weight, but you notice that more than 5 kg of your body weight has reduced over a short period of time, or you have gained more than like 5 kg of your body weight over like a short period of time without even changing your diet. It could also affect your appetite, where you feel the need to eat more, or you have no appetite at all, where you don't even want to eat anything at all. Now, the next symptom of depression is fatigue or low energy. When you find it difficult to get out of bed in the morning, it's because you don't even have the strength to get up and do any of the things that you want to do. People who are clinically depressed experience low energy, which means they have no drive, no motivation, and they are physically, emotionally, and mentally exhausted. The next symptom of depression is insomnia or hypersomnia. Insomnia meaning that you're sleeping way too little, and hypersomnia meaning that you're sleeping way too much. People who tend to be on the hypersomnia scale tell me that the reason why they end up sleeping a lot is because they're so tired, and also they use it as a way to escape the reality. They don't want to have to be awake, because when they're awake and alive, they feel the pain and the frustration that comes with being depressed. So they don't want to have to experience it. So as a way of escaping from their reality, they tend to sleep more. And people who are insomniacs tend to have anxiety, I've found, especially the clients I work with that are depressed. When they're having insomnia, they're most likely anxious. They're thinking, their mind is constantly working, they are ruminating over the same thought. Another symptom of depression is a feeling of worthlessness, self-blame, and inappropriate guilt. So it's not even your fault, but you find a way to make it your fault. You blame yourself for almost everything that is going wrong in your life. You're taking responsibility even for the situations that are not even your fault. And accompanying that is a feeling of worthlessness, where you're like, there is no point for anyone to love me. There is no point for anyone to care about me. Nobody loves me. Nobody wants to support me. So it's like you tell yourself that you are not worth anything. Another symptom of depression, second to the last, is difficulty concentrating. People who are clinically depressed find it difficult to focus their attention on the work they're doing and even just present time conversation. Their mind tends to wander away, and it's either obsessing about how bleak their future is or about the amount of pain that they've been experiencing in the past and are still experiencing in present time. So they experience very, very difficult time trying to focus on what it is that they're trying to do, because their mind always tends to wander away. Now, the final symptom of depression is recurrent thoughts of suicide and death, and even to the point where they act on those thoughts. So people who are depressed go from a feeling of low mood, lack of interest, not sleeping well or sleeping too much, not having an appetite or eating too much, blaming themselves for everything that's going wrong in their life, feeling helpless about being able to change the situation that they're in, feeling a sense of worthlessness, to now asking yourself, what is the point of living? Life has no meaning, life has no purpose. And as that thought keeps growing in their mind, they start to think of, what if I just ended it all? If I died, I wouldn't be an embarrassment to the people around me. Some people end up going through with the act of suicide and succeed. Some people go through with it, they don't succeed and are able to get help and get better. While some people stay in a space where they know that they have a family that loves them and they know that they don't want to hurt those people. So what they do is they just pray that something else would take up the responsibility of taking their life. So if you have ticked out 5 or more of these symptoms and that you're experiencing this in your current life, I'd say that it is very important that at this time you speak to a therapist. I'm going to put down the information in the description box where you can either contact me for a therapy session, because I do work with people who experience depression, and I'll also put down the information of NGOs that are offering free counseling sessions for people who are experiencing depression. Okay, so now we're going to talk about how is depression treated. And during this time, because I know there are not a lot of people who cannot afford to get therapy here in Lagos and Nigeria, I'm just going to walk you through a simple step that I work with my clients, like cognitive behavioral therapy, so that you can try it on your own, because self-therapy is a thing. It does take a bit longer because as human beings, we tend to want to run away from getting to know ourselves better. But I will try to make it as simple as possible. And if you get stuck anywhere, you can always send me an email to ask me for help, and I'll be willing to help you out. Okay? Can depression be treated? Yes, it can. Yes, it is very possible. There are a number of treatment methods that are available for depression. The first one is talk therapy, which is psychotherapy, which is what I major in. So with talk therapy, what we do is we sit down and explore deeper into who you are as a person and all the pain points in your life that are causing or triggering depression within you. So the first thing that I do in therapy with my clients is to listen to them. So for you now, you don't have anyone to listen to you if you're working on this by yourself. So what I'd recommend you do is get a notebook and get a pen, and then begin to write about every single part of your life that is causing you pain, without judgment, without condemnation, and without shaming yourself. Say exactly what's going on, say exactly how you feel about it every single day. Write about all the things that are frustrating you, all the things that are making you sad, what situations are making you feel like you're helpless. So now when you then have all of that written down, the next step I move to with my clients is we start to choose them one by one. You can't tackle all the issues all at once. It's not possible. Let's say, for example, like for me, when I was depressed, I made a list of all the things that were frustrating me, and I first of all started with body image issues, which is something that I struggled with a lot growing up. The way my face is, the way my body is, the way I choose to dress. So the first thing I said I was strong enough to tackle was my body image issues. So for you, when you make that list of all the things that are bothering you and you're struggling with, just start with one. No pressure. Choose one thing that frustrates you and then decide to focus and tackle that particular problem. Now, in the process of tackling it, you're going to have to explore it a bit deeper. Why is this issue present in my life? I always say it's good to start from your childhood. Maybe something I experienced when I was growing up, maybe I experienced verbal abuse, sexual abuse, physical abuse, and emotional abuse from my family, from school. Maybe it's an idea that was put in my head from the media, TV that I was watching, music videos, magazines that kept telling me that this is the perfect way for me to look, and if I don't look this way, I'm not going to get approval, love, or validation from people outside of me. So ask yourself, what exactly created those feelings within me? Self-awareness is the first step to healing, because you can't heal what you don't know. Now, in the process of you trying to get to know more and explore deeper, it is good to now pair this with information and knowledge. So don't just sit in your own space exploring your behavior by yourself. Talk to your friends, talk to your family members, open up to them and ask them to give you their own insight into who you are as a person. So when they give you feedback, don't take their feedback as the word, like that is the truth. No, just take it and then come back into your safe space and then think about it some more. Explore yourself deeper, get to know who you are, and also then read about other people's experiences. You can go on Quora. Quora helped me a lot. And I even asked people questions on Quora about how to get over some of the issues I was having. So by the time you have an idea of what is causing your issue, then comes the behavioral change, which is also paired with cognitive restructuring. So you have to change the way you think about the situation and change the way that you act. So for me now, changing the way I thought about my body, I started to tell myself that I don't need to look a certain way or have my body in a certain thigh gaps and the rest of them for me to be perfect, for me to look beautiful. If I didn't wear makeup, I wasn't good enough. If I didn't have like those expensive wigs, I wasn't good enough. So I had to now tell myself that it wasn't necessary for me to look that way for me to be beautiful, that I was my own definition of beauty. So as I was saying that to myself and pairing it with positive affirmations every day, where in the mirror I look at myself and tell myself that I'm beautiful, I started to take more pictures of myself. So I pair my cognitive restructuring, that's changing the way I think, with changing my behavior. And I also watched and read materials that were focused on that particular issue, which was body image issue. So whatever challenge you're having, just follow that step. First of all, start with expression, then from expression, then go to exploration as a way to understand and be aware of yourself. And then when you now move from the process of exploration, then go to the restructuring of your thoughts and then behavioral change. And you can restructure your thoughts through positive words of affirmation by reading more, gaining more knowledge that has to do with the issue, and then pairing it with behavioral change. So now the behavioral change was, what do I actually want my body to look like that would make me happier with myself? So then I decided, okay, maybe I should add a bunch of weight over here. I should lose some weight over here. These are part of the things that would make me happy. And the more that I started to do the things that made me happy, the happier I felt with the body that I have. So it's the same for you. Now, your behavior change may require you to be more confident, means that you have to have difficult conversations. You have to have the courage to say exactly what it is you want. You have to be more assertive. Whatever behavioral change is required of you as a way to feel better, you have to engage in it. Now, if you don't want to do self-therapy, you can always reach out to me by booking a therapy session with me or reaching out to any of the NGOs whose information I'll be leaving in the description box and asking them for help. The next treatment method available for treating clinical depression is the use of antidepressant medication. Now, there is a severity scale for measuring how severe a person's depression is, and it can range from mild to moderate to moderately severe to severe depression. Now, when you fall in the category or the area of moderate to severe depression, you are most likely going to be put on antidepressant medication, which is used with psychotherapy together as a combined method of treatment. The third treatment method that is available for dealing with depression is exercise. What exercise does is it helps with mild depression. It helps to release endorphins into your blood systems, which are like happy chemicals that would uplift your mood. And the best thing about exercise is, as you're exercising, your body energy is increasing, and then you feel a lot more confident in who you are and how you look. So for people who suffer from mild depression, you can treat your depression by trying to exercise every morning. Something as simple as 10 jumping jacks or just 10 leg lifts is enough to get you through the day, to give you the energy you need. You can even try to do yoga for like 5 to 10 minutes to help stretch out your body, help you breathe a lot calmer, and give you the exercise and the endorphins that you need to get through the day. Now, the final point is electroconvulsive therapy. Now, electroconvulsive therapy is particularly effective for people who are suffering from psychotic depression, which means that their depression is severe and causes them to have a break in reality. There is a split between what is realistic and what isn't. They cannot tell the difference. So if a person is experiencing psychotic depression, a way to help treat them, to help them feel better, is electroconvulsive therapy. There are other methods that are coming out now every day. Scientists and researchers are working on better ways to help treat depression and to help understand what the causes are for depression. But for now, these 4 methods, I'm going to give them to you, especially the one I mentioned in the beginning, to try to use CBT to help make yourself feel better. If you cannot take care of yourself by yourself and you can afford therapy, I strongly advise that you go and start therapy. Therapy is a very bold and courageous step that anybody can take towards making sure that their mental and emotional health is better. And I say that you should also give it a shot. Make sure that when you're about to start therapy, that you do a bit of research into who your therapist is, so you know exactly what it is that they work on or focus on, so that they can help you deal with the specific issue that you are having. Okay? So that's all I have. I do hope that in this short minute, I've been able to educate you on what depression is, what causes depression, what the symptoms are for depression and how to treat depression. If you have any more questions, please feel free to email me. I will leave all my information in the description box below. And don't forget to subscribe if you are interested in listening to more emotional and mental health information, and to click the notification button so that you can know whenever I release new videos. Thank you for watching, and I'll see you soon.